How's it going? I decided to do a marathon of recordings today, so I'm wearing the same shizzle because I don't know how much time I'm going to have next week to do it. So here I am again. So what I want to talk about right now is the difference between essentially a voice therapist and a voice teacher. I actually had somebody ask me, should I go to a voice teacher or a voice therapist for this problem? And it was actually a very good question. It was someone who's not really trained to be a singer. She has sung a lot in choirs, as a kid, throughout school, essentially, and now she's an adult, and she's like, when I sing, my voice still sounds a little childish, and so should I do a therapist or should I do a teacher for that? My answer is a teacher to that question, and I just want to get into a little bit of why, just to help anyone out there who might be maybe on the non-professional singing track, but you're just curious, and how do you get better, and what's a sign that you do have a voice problem, and what's going on with that. So for the latter part of that, though, if you think you have a voice problem, you can actually Google like when to see a voice therapist, and you'll probably find a lot of websites from a lot of voice clinics, especially in the United States, that will outline pretty good guidelines of when to be suspicious, essentially, when to get looked at by a doctor. So I would encourage you to do that. I'm going to try not to repeat a whole lot of what they say there, because it's right there. It's all out there, and it's said much better than I can say it. So here we go. So what I think is one of the biggest differences between a voice therapist and a voice teacher are the basic assumptions they start with and the goals they're trying to get to. So one of the basic assumptions I have, at least as a voice teacher, is that I assume that the voice that's walking in, that person who's walking in, is likely, by default, they likely have a pretty healthy voice. They have a voice that's working for them in their daily life. It might not be free of injury or anything, but I assume it's healthy, it's functional, it's working for them. And I kind of see myself a bit as like a personal trainer for voice when I'm putting on my voice teacher hat, I'm just trying to take this otherwise healthy voice and give them some skills and give them some techniques to increase their vocal capabilities to sort of, essentially athletic proportions, right? So similar to a personal trainer training you up to lift heavy weights or to run a marathon or whatever the heck it is you decide to train for. So that's how I see that. For voice therapists, though, when someone's walking into a clinic, so there's one thing, at least in the United States, you do need to see an ENT, an otolaryngologist, ear, nose, and throat doctor who specializes in voice, ideally. You want to get seen and you want to get an image of the vocal folds. They're going to essentially get some sort of endoscopy into either, it can go through your nose, which isn't as bad as it sounds, or through your mouth with a rigid scope, and they're going to take a look at the health of your vocal folds and the status there. So by the time you see a voice therapist, there's a sense of, are the vocal folds healthy? Do they have an injury? There's usually some kind of diagnosis that's been made, so the assumption is I'm seeing you as a voice therapist because something is wrong, okay? And admittedly, I don't have my full license yet as a voice therapist, but that's what a voice therapist in general would probably say, is their general assumption is something's wrong with this person's voice, it's not working for them, and my job is to figure out where the breakdown is occurring and to, if behavioral therapy is going to help, I'm going to teach them techniques to help them overcome this vocal difficulty they're having, this injury, this illness, whatever it is, okay? Try, hopefully, ideally, depending on the disease and the diagnosis, but the, hopefully ideal is you get them back to a healthy functioning voice that might be the voice they had before they started having a problem, right? So you just kind of want to level them up to where they were before they came to see you. So in that sense, a voice therapist really is much more like a physical therapist for an athlete, okay? So, athletes have their coaches, they have their trainers, and they have physical therapists for when something goes wrong, when they kind of twist that ankle a little bit last time they went out on a run, right? Or when that joint starts to really hurt, or they feel like they're developing a bit of like a tendinitis kind of thing in a joint, like they go to the physical therapist for that, right? So similar thing for singers. If there's an ability that you feel you've lost, okay, you might want to seek a voice therapist, essentially. But if you're just someone who, when you're going throughout your day, you're going to your job, you're just talking with your family or whatever, your voice works for you, it's doing okay, but you don't really have any voice training and you want to learn how to sing more like a soloist, then yeah, voice teacher. That would be the person to go to for that. There are differences in training and sort of professional ethical boundaries of the two. In the United States, anyway, voice teachers don't really have any governing body they have to answer to. There's no kind of training they have to get. My ideal would be someone who knows something about how the human voice really works, and someone who probably has trained themselves pretty extensively in singing. But there are people out there who teach voice who don't really have a lot of training themselves. Some of them, I'm sure, are great teachers, and some of them, I don't know, maybe they could get better results if they, you know, took some pedagogy courses or something, but that's, you know, something to consider when you're looking for a teacher. Where do they train? How much do they train? Do they know how to teach the style you want to sing? It's pretty important. Is that person going to try to convert you like from a belter to a classical singer? Because if you don't want to sing classical, then don't go to someone who's only going to teach classical, right? Now, classical as a way to figure out technique to get to healthy production in a belt, fine, all for it, do it, go have at it. But, you know, if that person is thinking, like, if you ever sing in belt ever, you're going to hurt yourself, and you want to be a belter, that might not be the most ideal teacher, right? So that's something, it's a lot of legwork you have to do for yourself to figure out, does this teacher have the training that I want to benefit from, essentially? Do they have the philosophy and the training and the experience to teach me what I want to get from voice lessons? So it's good to have a good idea walking into your voice lesson with some idea of what you want. You want technique, you want to be able to access more of your range, you want more vocal power. What do you want from your voice lessons? And that can change over time, and you can discuss it with your teacher if you feel like you want something different than what they're giving you. And also you can change teachers. I mean, you don't have to stay with a voice teacher if you're not getting what you want. You really don't. And I know if you're a voice major, that might be a little stickier because there's political stuff that goes into changing voice teachers in those situations. But, you know, if you're paying out of pocket, you're doing this for fun or doing it to attain a certain goal, make sure you're getting to the goal you want to get to, you know? So that's my, like, tip on picking a voice teacher, I guess. Now, for voice therapists in the United States of America, anyway, they answer to ASHA, the governing body, the American Speech, Language, and Hearing Association. So speech-language pathologists who special in voice tend to call themselves voice therapists because it becomes a long title if you say speech-language pathologist specializing in voice. So they're the same people. And what you're looking for is someone who has CCC, 3 C's, a dash, and SLP after their name. That's who you're looking for as a voice therapist. Or they could have, like I have, CF or CFY SLP because I'm a clinical fellow, which means that person is, and they might be at a voice clinic. And I'm probably not going to do one at a voice clinic, unfortunately, but you know, they're under the training of someone who is an experienced voice therapist. Their supervisor has those 3 C's. The C's stand for Certificate of Clinical Competency, and it means that person has gone through a master's degree in speech-language pathology. They have the undergraduate prerequisites done. They went to a master's degree. They did clinical rotations during their master's degree. They passed a praxis examination that ASHA gives out essentially to say, yes, they learned stuff in their master's. They got a certain number of clinical rotation hours, which I believe is it 300? I think it's 300 hours requisite during the master's degree. And then if they have their 3 C's, they've already completed their clinical fellowship year, which is kind of like a residency, essentially, for SLPs in America, in the US of A. So that it's really your first job, but you're still under some supervision. You're just not on, it's not as heavy of a supervision as what you had during the master's program, but you're still under supervision. And at the end of what is essentially 9 months of full-time work, You get scored, you get sort of signed off by your supervisor, you send it into ASHA, and then ASHA says, yes, you have finished all the training necessary, here are your C's. Your 3 C's, right? And you can put that after your name. So that's what you're looking for. You're looking for someone who specializes in voice if you're a singer, if you want to have a really kind of exceptional voice, if you feel like there's something wrong with your voice. Go to an otolaryngologist who specializes in voice, and go to a therapist who specializes in voice and hopefully specializes with singers if hopefully there's one in your area or it's not too burdensome to go visit somebody. So there's more stringent guidelines there. And there are guidelines also for ethics in terms of how much they can counsel you, for example. Like, it's totally not my job to counsel you on, mental health issues you might have. If it comes up in a session that you're on the depressed side or you're having anxiety attacks or something, I might ask you, do you have someone you can talk to about that? Or would you like the name of a professional who specializes in helping with that? But I'm not gonna counsel you on how to overcome those. But if you're having anxiety attacks due to your voice not working, what I can counsel you on is, how to get your voice in better order. Like, okay, so, your voice is doing this. How do we get it to do this other thing? How do we get it to, we're going to replace that thing that's causing the problem with this other way of voicing, this other coordination that hopefully will work better for you, essentially. And so I counsel essentially to give someone a sense of empowerment over their voice problem. And sometimes that bleeds into other areas of life because empowerment is like a pretty big theme throughout life, right? Self-empowerment, feeling you have the agency to control something or to change something for you. It's pretty important. But I do that for voice problems. That's my area, okay? So there's all these nice guidelines for voice therapists, for SLPs who are looking, if you feel like you need an SLP, if you feel like you need a voice therapist at all. Like I said, you can Google if you feel you need a voice therapist. There probably are voice clinic sites that usually have some kind of information page on, when to see a doctor, when to see the otolaryngologist, what voice therapy can help with, and things like that. There's lots of them out there, and they all have very similar information across their websites. You could just look them up, compare, contrast, get some good ideas for that. But if you have a pretty healthy voice that works for you, like, rest of the time, like in your whole life, you're just like, yeah, my voice isn't that bad. It does what I need it to do. People can hear me. I can talk, whatever, right? Without pain or discomfort, that kind of stuff. You might want a voice teacher. If you want kind of a personal trainer for voice, you want your voice to just do something better in the area of singing, go to a voice teacher. But if you feel you have lost an ability to use your voice in a comfortable, easy way that you used to have, maybe look toward a voice therapist and a voice clinic that can look at your voice. So there you go. Hopefully that's helpful if you're trying to parse that out. See you guys next time.